Greetings of the day. In this video, we are going to discuss about the revised definitions of morphological features of the acute pancreatitis. This is from up to date. So in this, we are going to look after the 6 terms that should be used and should be known in case of acute pancreatitis. So coming to the definitions. So first one is the interstitial edematous pancreatitis. It is caused due to acute inflammation of the pancreatic parenchyma and peripancreatic tissues, but without any recognizable tissue necrosis. So on CECT, the criteria is there is enhancement by intravenous contrast agent. No findings of any peripancreatic necrosis as such. This is only pancreatitis. There is edema, right? So there will be leakage and there will be enhancement. So in case of second term is the necrotizing pancreatitis, it is inflammation associated with the pancreatic parenchymal necrosis and or peripancreatic necrosis. And the CECT criteria of this shows a IB contrast agents, lack of pancreatic enhancement, so and presence of findings of peripancreatic necrosis. So these are the two terms. Now the peripancreatic, the third term is the acute pancreatic fluid collection. So this is where the peripancreatic fluid associated with interstitial edematous pancreatitis with no associated peripancreatic necrosis. So this term is only applicable only when within first to 4 weeks and after the onset of the interstitial edematous pancreatitis and without the features of the pseudocyst. So CCT shows there will be homogeneous collection with fluid density confined by normal peripancreatic facial planes, no definable wall encapsulating the lesion collection, and also adjacent to the pancreas, right? So this is what is seen in the acute peripancreatic fluid collection. Now the pancreatic pseudocyst, an encapsulated collection of the fluid with a well-defined inflammatory wall, usually outside the pancreas with minimal or no necrosis. This entity usually occurs more than 4 weeks after the onset of interstitial edematous pancreatitis to mature. So the APFC leads to pancreatic pseudocyst after 4 weeks. And CCT shows well circumscribed, usually round or oval, and homogeneous fluid density, no non-liquid component, and well-defined wall. And maturation usually requires more than 4 weeks after the onset of the acute pancreatitis. Now, the fifth term is the acute necrotic collection. So, a collection containing variable amounts of both fluid and necrosis associated with a necrotizing pancreatitis. The necrosis can involve pancreatic parenchyma and or peripancreatic tissues. And CECT criteria occurs only in the setting of acute necrotizing pancreatitis. Heterogeneous and non-liquid density of the varying degrees in the different locations can be seen. There is no definable wall encapsulating the collection, and location is either it can be intrapancreatic or extrapancreatic. Now this is less than 4 weeks. So more than 4 weeks is the wall of necrosis. The mature encapsulated collection of the wall of necrosis is a mature encapsulated collection of the pancreatic and or peripancreatic necrosis that has developed a well-defined inflammatory wall. Wall of necrosis usually occurs more than 4 weeks after the onset of the necrotizing pancreatitis. In CCD, we can find heterogeneous with a fluid, liquid, and a non-liquid density with varying degree of locutions. Some may appear homogeneous. So a well-defined wall may be seen that is completely encapsulated. Location is may be intrapancreatic or extrapancreatic, and maturation usually requires 4 weeks after the onset of acute necrotizing pancreatitis. This concludes this video. Thank you for watching.